140,000 New Yorkers have already received one vaccine. That would put New York at the top of the national chart on number of vaccines that have actually been given to people. We expect another 259,000 vaccines this week, 139 from Pfizer, 119 from Moderna. Where are the vaccines going? This is where the vaccines will have gone to date by the end of this week. We're shipping as we speak, and by the end of this week, this is how many vaccines will be given out all across the state. They will not have been necessarily administered, but they will have been delivered. Well, why does one place get more than the other? This is, again, math. This is proportionate to the number of people eligible for the vaccine in that region. It's probably roughly proportionate to the population, but that's how we do the allocation. It's not that we like Capital Region more than Central New York. It's all on the math. Who's getting the vaccine? We have priority populations. As we have more vaccines, the priority populations expand, right? We're going down the list. You have the number one priority, 2, 3, 4, 5, 6, 7. More vaccines, you just work your way down that list. This week, it's going to be urgent care center employees, individuals who are administering the COVID-19 vaccines for obvious reasons, including the local health department staff, residents of OASAS facilities. These are congregate facilities. Congregate facilities are problematic. It's where you have a lot of people in concentration. Nursing homes are obviously the most problematic because they're congregate plus older, vulnerable people. OASAS, what we call the O facilities, they're congregate, not necessarily older, but congregate facilities. We'll then continue with high-risk hospital care workers, federally qualified health center employees, EMS workers, who are the people who show up, God bless them, and respond to calls, coroners, medical examiners, funeral workers, other OMH facilities, et cetera. These are all congregate facilities where you have a number of people in one location. Who's getting the vaccines? Next week, we expect to open to ambulatory care health workers, public-facing public health workers, again, including those administering the COVID-19 tests. We have now a whole group of people who are interfacing with the vaccines, with the testing, and we want to make sure they get the vaccine.